When I saw my podiatrist, there was no circulation to my toes at all. During this time, I discovered how painful it was for me to put any closed-toed shoes on. That ended up taking away my ability to work out. It was very, very painful to have anything near my toes. He then recommended I see Dr. Hassan in vascular medicine for further evaluation.
First time I saw Miss Litvin was about, again, 2 or 3 years ago. She presented with toes which had spots on them that look like as if they were not getting enough oxygen. So they look dark, blackish, almost breaking out in sores, possibly gangrenous. That was the first time I saw her. It was around winter time, and usually when patients present with these things, it's usually around the time when the weather is on the colder side. She was upbeat about it, and I was telling her that the toes are being threatened. There's not enough oxygen going to their toes, and they're not looking really good. And she was very, very positive and said, well, how can you help me? And I thought, yeah, well, that's the right question. How can I help her? We got rolling, and we started her on the medical management of what we called was an advanced stage of vasculitis from her underlying conditions that she was having, the autoimmune disorders, which was presenting itself as vasculitis. And rheumatology was taking care of that. But this ischemic episode, this lack of oxygen tissues causing the presentation, is truly where vascular medicine can help. And we started her on a regimen, a very complex regimen. And the first time we were able to abort the entire thing in about 6 to 8 weeks.
So that was something that I was glad to get to the other side of because of how it changed my life during that time.
And she did well for almost a year until she came back the second time, and which was the tougher challenge of the two, because the second time around when she came in, she had more advanced disease. It was a more aggressive presentation associated with a lot more pain and discomfort. And once we ramped up her medical regimen, where we put her on medications to decrease the platelet stickiness, such as aspirin, we put her on blood thinners to make sure that we're getting enough flow through it. And then we put her on a vasodilator, something that dilates the blood vessels in the smaller vessels. And I'm not talking about the larger vessels that we normally palpate. I'm talking about vessels that we normally don't see per se, but they are the ones which are supplying blood to the small vascular beds of the legs, the hands, the feet, and so on and so forth. So that had to be opened up again. And the medication we used at that point was, again, we used the first time, we used the second time, was sildenafil, popularly known as Viagra or Revasio. But that medication was being used as off-label.
Viagra. Well, I actually thought it through. I thought, well, ultimately, it does appear that it has to do with blood circulation. Doesn't matter where it goes, as long as it goes to the right place. Let's have at it. Throw it at me.
But this time around, as compared to the first time, when I saw her back in 6 weeks, it looked a lot worse. And that is a time when even I started getting worried, because now we were failing advanced therapies. The pain was much more intense. The gangrene was spreading. I did want to get a second opinion, so I asked one of my vascular surgeon colleagues to also look at this. And they rightly said, if this continues, we may have to amputate the toes. Not good news for her, definitely not good news for me, because like I said, I'm here to help. And if it comes to that, then I have failed at some point. The pain kept getting worse, the gangrene kept getting worse, and I was lying down one day at night in my bed, and I'm like, what should I be doing here? Am I missing something? And I remembered that some of our patients, older patients who have no options of revascularization, you can't open any vessels in them, and they have such presentation. I had used successfully an art assist pump, and a pump that effectively improves arterial circulation. But in studies, it has never been shown to be positively positive, like, oh my God, if you use this, all things will go away. In studies, it has shown that it has some improvement, but not remarkable improvement, and hence it's not the standard of care. And I'm like, we have nothing to lose here. So the following Monday, I called her and I said to her, we're going to try the ArtAssist pump.
Because what that was a machine that it came with a boot. I would strap one behind my knee, one behind my leg, one strap across my foot, engage the machine, and it ultimately was like blood pressure to your legs and feet. And that, I'm certain, was the straw that fixed the camel's back, because that totally stimulated the circulation in my toes, totally.
And in the following 8 weeks, it may have been the medications, the aspirin, the blood thinner, the pump, all together, but she turned a corner. And I was calling her almost every second, third day, asking how she was doing. She was sending me pictures, and we were in constant communication. And about 8 weeks later, after doing all that, we were seeing signs of improvement and healing, and the pain was getting better. And that was the time when I said, okay, we got this. It's coming back to normal. And as a physician, as a provider, it's like scoring a goal, because nothing feels better when your patients do better.
I was very lucky to have somebody like Dr. Hassan, who again went way outside of the box for me, because he said, if I don't win, you don't win. And I thought that was very rare for a doctor these days. I have my toes today. I have my health today. I am Henry.